I'm your student nurse today. How are you?
I'm good, thank you. Yes, I'm Claire, and this is my husband,
Hi.
Michael.
Nice to meet you.
Nice to meet you too.
How can I help you today?
Well, it's kind of embarrassing.
There's no need to be embarrassed. I'm here to help you. What brings you here today?
I'm feeling constipated all the time. I just can't seem to go when I want to go. Do you know what I mean?
Yes, of course I understand. How long have you been constipated, Claire?
I have been having these issues for a while. This started when I was a few weeks pregnant. I just thought they would just go away.
Do you feel the urge to have a bowel movement?
Yes, and when I try to go, nothing comes out. Sometimes I feel so stressed out just by the thought that I would like to have a bowel movement.
I'm sorry to hear that, Claire. Can you tell if there's a solid, liquid, or gas in the rectum?
It's definitely solid.
Constipation is normal to pregnancy. Right now, your baby is pressing on all of your intestines, so there's a lot of pressure on them. Also, a pregnancy hormone called progesterone relaxes all the smooth muscles in your body, which include your intestines. So the wave-like contractions, moving your food along your digestive system, is slower during your pregnancy.
Will my constipation affect my baby?
No, it will not affect your baby. There is nothing to worry. We just have to make a good plan for you so your constipation won't lead to serious medical problems such as hemorrhoids, rectal bleeding, and rectal fissures in some cases.
I'm sorry, but what are rectal fissures?
Rectal fissures are tears that occur in the lower rectum that cause pain during bowel movements due to the passage of large or hard stools.
Oh, I see. So what can she do to reduce constipation as often?
I would encourage you to add more fiber in your diet. Do it gradually though. A sudden increase in fiber may cause bloating, gas, and diarrhea. You can eat fresh fruits, beans, vegetables, and bran cereals. Fiber helps prevent constipation by giving stool bulk. Increasing your fluid intake to 1.5 to 2 liters per day helps as well. Adequate fluid intake is necessary to prevent hard and dry stool.
That is not too hard to follow, Claire. I will make sure that you are eating healthy, eating enough food rich in fiber, and also drinking good amount of water per day.
It's really not a pleasant experience for me because the pain is unbearable at times.
I quite agree with you. It's not an easy thing to go through, but since your husband has promised to make sure you eat well, you will definitely be relieved.
Is there any other way to relieve constipation?
Have you been moving a lot and doing exercises lately, Claire?
No, I'm not even sure of what exercises I can do.
Try to get out of bed as soon as possible and do your activities of daily living independently as tolerated. You can do minimal exercises as simple as turning, changing positions in bed, lifting your hips off the bed, doing range of motion exercises, stretching arms away from the body. Activities even minimal increases peristalsis, which is necessary to prevent constipation.
Okay, I'll try to move as much as long as I can do it.
For sure, I am here to help you and support you all the way too.
That is really nice of you guys. I would also encourage that you establish a regular schedule for defecation, preferably within an hour after meals. And when you go, try to relax. Don't stress out. Do deep breathing. Relaxation helps your pelvic floor muscles and sphincter relax, and that promotes evacuation of the stool.
Thank you for your help, Sandra.
You are most welcome. What are you committed to do to help manage your constipation, Claire?
I'll increase my fiber intake gradually, increase my fluid intake too, do minimal exercises and perform activities of daily living independently as much as I can. I'll also keep a diary of my bowel movement and I'll try to establish a regular schedule for defecation. And of course, I'll not forget to relax while trying to defecate. I learned a lot today. Hopefully I'll be able to manage my constipation well.
You got everything that I taught you right on. Great job, Claire. Please come back in 2 weeks so we can reassess you. Would that be possible for you?
For sure. I'll book an appointment and mark the date in my calendar.
Thank you so much.
Thank you.
Have a great day, and I'll see you in 2 weeks.
Thank you.